This is Roy, and this is Lab 2 of Biomechanics. We used electromyography to measure grip strength and muscle activation. DeLuca outlines efficient practices in his article, as well as indications for EMG. We also looked at active insufficiency and how muscle positioning can affect the force generated by certain muscles. Schoenfeld discusses active insufficiency in the context of strengthening and conditioning muscles. So in this lab, we manipulated a subject's wrist position and observed both the physical and electromyographic effects. We tested the hypothesis that any deviation from a standard position, which would be described later, would decrease the amount of force produced. We had a sample size of 8 Regis DPT volunteers. 5 were female, 3 were male. The mean age was 26 years, with the range of 22 to 32 years. The inclusion criteria included able to sit and stand without pain and the ability to produce maximum grip force. Exclusion criteria was any history or current diagnoses affecting grip strength, as well as sensitivities to adhesives. We prepared the dominant arm by shaving and cleaning the area with an alcohol wipe. We measured the flexors and extensors, so 2 electrodes were placed on the anterior side of the forearm, 2 on the posterior side, and a 5th grounding electrode placed on the muscle belly of the tricep. The maximum hand grip was measured in the standard position with the subject standing, elbow bent at 90 degrees, and this was recorded as the maximum voluntary contraction. It was also the peak EMG recorded in volts. We tested 4 different positions. 2 with the same standard grip, but the wrist in maximal flexion and maximal extension, and 2 different grips, one with the shortest setting and one with the longest setting, both with the elbow still at 90 degrees. The activation and force production are represented as a percent of the MVC. We addressed the hypothesis by comparing the values before and after manipulating the wrist position. We collected 2 dependent variables: muscle recruitment or activation measured in volts, and force produced represented in kilograms. Table 1 has all the percent values, but through text I wanted to emphasize the resultant flexor activation means. I also wanted to frame force production as a decrease, not merely report the percent standard raw score. These results supported the hypothesis that any deviation from the standard position would impair force production. With the wrist in the maximum force flexion position, we saw the greatest decrease of activation as well as the least force produced. In this position, the extensors recruited more muscle activation fibers but generated less force compared to the percent standard. When we look at these implications in the clinical setting, we can apply these principles to proper positioning and technique during exercise. 2 main considerations come to mind. The first is making sure that our patients are exercising the correct muscles. Also, EMG can be used as a biofeedback modality to make sure that the correct muscles are being activated. Thanks for listening.